What is the connection between diabetes and cancer? Cutting edge, groundbreaking research has solved this riddle. Why do we as diabetics have as much as a 2.5-fold increased risk for certain cancers? You will not only know how cancer starts in the first place, but what those cancer cells need to grow. And this is new, and most importantly for us diabetics, how to control it once the cancer starts to mutate. But before we begin, let me welcome all of you resilient diabetics out there. This is the channel we turn ordinary, struggling diabetics into extraordinary, well-controlled diabetics. If you don't know who I am and you are brand new to this channel, I welcome you. My name is Jay Sampat, and I became an insulin-dependent diabetic a little over 6 years ago due to an autoimmune attack which caused the destruction of my pancreas. So not only am I a diabetic just like you, where we will be walking that walk and talking that talk together, but I do also have a University of Bachelor of Science degree in nutrition dietetics, and that does come in very handy in discussing all of these intricacies of being a diabetic. Don't forget to hit that subscribe button followed by the gray notification bell, and then choose turn on all notifications if you want to be notified when the next Resilient Diabetic video has been published. And I would greatly appreciate you smashing that like button if you learned something new today. As with all of my videos, this should not be considered personal medical advice. This is my interpretation of the latest research. If you want medical advice, always consult your physician. The hypothesis that diabetes and cancer are linked is by no means a new idea, but it has never been previously confirmed until now. For years, scientists have been trying to solve this medical mystery. Why do people with type 1 or type 2 diabetes have an increased risk of developing certain forms of cancer? And as mentioned, we as diabetics have a 2.5% fold increased risk. Today, you will know the explanation for this perplexed double whammy. Unlike bacteria or viruses, which infect the body from the outside, cancer originates from our own body cells. The disease begins deep in the cell nucleus, in the chromosomes that contain our genes. Of the approximately 22,000 genes in the human cell, only several hundred are involved in the process of cell division. These genes ensure that division occurs on an orderly, controlled manner, that each step in the process occurs in the right order, at the right time, and that after a certain number of divisions, the cell dies. In adults, cells normally grow and divide to make cells only when the body needs them, such as to replace dying cells or damaged cells. Normally, our cells follow these instructions and we stay healthy. But a cancer cell doesn't act like a normal cell. It starts to grow and divide out of control instead of dying when it should. Cancer can start in any cell within our bodies. So yes, you naturally get cancer cells all the time. It is your immune system's job to find those rebellious cells and kill them before they become a problem. Actually, before they become bigger than the size of a fingernail. It is the immune system that ultimately wins the day. If you look at cancer as a genetic disease, we are looking at thousands and thousands of different pathways big pharmaceutical companies can go after and make money on new and novel drugs. The only issue, they work for short periods of time before the cancer cells figure things out and they adapt. And then in the end, certain cancer cells usually win. But if you think of cancer as a metabolic disease like diabetes, high blood pressure, and even Alzheimer's and dementia, as I've already mentioned, then you can tip the immune system in the favor against cancer growth by creating a hostile environment. The caveat? There is no money to be made with this kind of thought. Why? It all depends on what we put in our mouths. The intimate connection between carbohydrates and cancer has been long known in studies performed by physiologists even way back in the 1920s. In treating diabetic patients, scientists observed in those that developed cancer, glucose secretion in the urine disappeared. So that led to the big unknown question, where was all that glucose going? Further culturing of cancer tissue showed they consume more glucose than muscle or liver cells. The connection between cancer patients with metabolic syndrome abnormalities have been known even earlier than that. Since 1885, a man by the name of Ernest Friend described signs of hyperglycemia in 70 out of 70 cancer patients. He even showed glucose tolerance and insulin sensitivity were diminished in cancer patients even before signs of weight loss became evident. So they knew already both diabetes and cancer were characterized by a common state of chronic inflammation and insulin resistance. The most accurate and well-known experiments were published by Otto Warburg and colleagues in the 1920s. Warburg observed that tumor tissue would convert high amounts of glucose to lactate even in the presence of oxygen, a metabolic phenotype now referred to as the Warburg effect. Today, the Warburg effect is an established hallmark of cancer. What does all this mean? Cancer cells are glucose dependent. They cannot use fats or ketones for energy like the rest of our normal body cells. So what has rocked the scientific community? Extremely strong recent evidence has strengthened with the proposed relationship between insulin resistance, diabetes, and cancer. It is becoming more and more clear that hyperinsulinemia and sustained hyperglycemia or high blood sugars are important regulators of not only the development of cancer cells, but the treatment and the outcome. Since they know cancer cells are completely dependent on glucose to sustain itself and survive, they could just simply measure the blood glucose levels in samples and divide them by whether or not they were above or below 120 milligrams deciliter, a common clinical measure of diabetes. Not surprisingly, they found a robust correlation. The higher the blood glucose concentrations, the worse the survival amongst patients with certain cancers. Another new review analyzing the data collected by 47 studies from across the globe, including the United States, United Kingdom, China, Australia, Japan, just to name a few, confirmed beyond a doubt that diabetes heightens the risk for cancer. But what the study's authors noted was that women with diabetes are especially affected. They appear to be more exposed than men to the development of malignant tumors. They found that small section of DNA in charge of cell division sustains more damage and becomes unrepairable when blood sugar levels are high compared to blood sugars at normal, healthy levels, thereby increasing the risk of developing cancer. Also simply put, the higher the blood sugars are, the faster cancer cells can grow. Second, high insulin levels and inflammatory cytokines have been proposed as the cause of the initial mutation of our normal body cells. Experts as far back as 1863 long suspected inflammation plays a role in the development of cancer. They already observed cancer develops in sites of chronic inflammation. The concept of inflammation is sometimes tricky to grasp because it seems contradictory. On the one hand, inflammation is a healthy process, essential for the body to heal itself. When you have an infection or injury, the immune system releases white blood cells and chemicals to fight off the infection to repair damaged tissue. But when inflammation persists, or when the immune system triggers an inflammatory response, when you don't have an infection or injury, that is when we have a major problem. Remember, the key to this is hyperinsulinemia, or high circulating insulin levels, which, as you know, causes the body to remain highly inflammatory. In the video, The Most Powerful Weight Loss Tool, we discussed Dr. Joseph Kraft, a medical doctor who measured over 14,000 oral glucose tolerance tests in his lifetime, but most importantly, included the corresponding blood insulin levels too. Dr. Kraft observed that 83% of his subjects failed his test, meeting the criteria for having hyperinsulinemia. I'll put a link in the description box below if you missed that important episode. So, in other words, hyperinsulinemia, or high insulin levels, is prevalent in society, mainly because we consume that standard high-carb American diet. All thanks to insulin, it is really quite simple to grow breast cancer cells in a lab. The recipe has been used successfully for decades. Take breast cancer cells, add glucose, growth factors like IGF-1 from insulin, and lots of insulin, and cells will grow like weeds in a garden. Breast cancer cells contain 6 times the number of insulin receptors as normal breast tissue. That would certainly explain why they need insulin so badly. So what do we as diabetics do to prevent, or at least help, our immune system keep our body cells from mutating and growing? Well, this is where things are getting really exciting. Over the last few years, evidence has accumulated that by systematically reducing the total amounts of dietary carbohydrates in the diet, one could suppress or at least delay the emergence of cancer so that existing tumor cells could be slowed down. How? One, as already mentioned, contrary to normal cells, most malignant cancer cells are not, I repeat this, not able to metabolize fatty acids or ketone bodies due to mitochondrial dysfunction. Second, insulin and insulin-like growth factors resulting from the chronic consumption of carbs around the clock, like in our Western diets, will be reduced. In addition, many cancer patients exhibit altered glucose metabolism characterized by insulin resistance and may profit from an increased protein and fat intake. This is where, if one was diagnosed with cancer, a low-carb, low-insulin diet, even a keto diet, for instance, would help tip your immune system into your favor. And this is where a lot of new research is going. They are actively looking at the keto diet, mainly because glucose is completely restricted and insulin levels are muted. So simply put, they want to choke cancer cells from their main fuel source, glucose. They also realize that the diet does not, and I repeat this, the diet does not cure cancer, but it does complement the standard cancer therapies such as chemotherapy and radiation therapy. Protein metabolism also forces cells to use less glucose to fuel energy production. However, studies do suggest that it does not cause the same level of oxidative stress as fat metabolism. There are multiple clinical studies underway now investigating the anti-cancer effects of the keto high-fat diet. And I must admit, some of the before and after images are simply amazing. I do not have the rights to share them here, but I will put a link in the description box of a video to watch. In another very, very well-controlled study, they administered the keto diet to 5 late-stage cancer patients. It was a 60% MCT oil, 20% protein, 10% carbs, and 10% other fat diet. After 7 days on the diet, mean body weight actually increased by 2 kilograms and their physical performance improved. Within 7 days on the diet, blood glucose levels decreased to normal, while glucose uptake by the tumor, estimated by their PET scans, had decreased by an average of 22%. Notably, body weight remained stable throughout the entire study of 8 weeks. Why the constant talk about body weight? Because this is the counter argument made by the high carb proponents, the ones that want you eating the standard American diet of 4 high-carb meals per day, along with 2 more high-carb containing snacks. They believe it's counterproductive for anyone struggling to maintain their weight while dealing with the side effects of cancer and its treatments. More importantly, they say the anxiety of trying to completely avoid all sugars creates more stress. And this makes me want to throw up, because if you've been following me and you are subscribed, and I know you are, then I've already proven to you the opposite occurs. Carbs create environments that produces not only an addiction, but makes you hungrier and hungrier for more carbs. I intimately understand the pressures modern medicine will put on cancer patients. My father just passed away a little over 3 months ago due to a very aggressive form of cancer. His dietary regime was a high-carb diet prescribed by the head of oncology at his hospital to maintain his weight during his experimental treatment. I cannot explain how frustrated and angry that made me feel, knowing full well that diet would speed up his death. I humbly made my suggestions to my family, but to no avail. Plus, my dad loved, and I mean loved, his carbs, and always has. He could snack on junk food like it was no one's business. The power of his doctors and their current understandings of cancer and diet overruled any of my explanations and concerns. Please remember, what we are learning is new today. Doctors are taught to treat cancer as a genetic disease. They see no correlations to diet yet. But mark my words, this is coming. I know I cannot change the entire world's view in an instant. Not only is it ingrained, but the powers to be rely on carbs to feed the world. And so, it will kill the world. But I can help you, and you alone, by placing that seed of knowledge in your hearts and in your brains with some simple, undeniable truths. And what are they? If we as diabetics maintain normal blood sugars, and to me personally, normal means an A1C in the low 5s and the upper 4s, and I keep mentioning this, use and require just the right amounts of insulin, then we in the long run can give our bodies a real fighting chance of surviving. But not just surviving, living a life free of complications and diseases. In the video, The Most Powerful Weight Loss Tool, I explained how this weapon can not only provide permanent weight loss, but lower your A1Cs and reduce your insulin and medication requirements. And now you objectively know the role of sugars and insulin have on cancer. This mysterious tool we all have will get your immune system optimized to fight those rebellious killer cancer cells too. If you're on your desktop or laptop, I want you to use a mouse to click this upcoming box. If you're on your mobile device, tap that with your fingers. The first is the link to subscribe to this all-important channel. The second is the link to the video mentioned on this mysterious tool. Bye for now.